Joined now by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. And we always appreciate your time, Doctor. As we just mentioned, as we are going to tell you right now, there's a new study on remdesivir. So why do they think that adding a second drug could work, and where do we stand with treatments for COVID-19?
Right, so the NIH is going on another phase of this adaptive trial design where they're looking to really find the right combinations. We heard about the antiviral remdesivir before. Now they're going to add an interferon to this and to try to figure out, is the combination better than the placebo, which will contain remdesivir? So it will be remdesivir plus beta interferon versus remdesivir plus placebo. And, we'll have to see. The good news is that we've used interferons like this before to treat multiple sclerosis. So we know its side effects, and we'll just have to see whether this works. Hard to know without going through the actual trial, seeing the results to know whether this will be effective and safe.
So still working on therapies. We know also there are factors that put certain people at higher risk of death from the virus. One of those, obesity. There's new data that appears to show men with obesity are impacted more than women.
Right. So, hi, Arca. So basically, this is a Kaiser Permanente study. It's retrospective. That's important. So it's not the gold standard study. But what they showed is obesity was a driving factor, especially for men and those that are under 60. Remember what we have here. We have a collision of two epidemics, COVID-19 on one hand and obesity on the other. I don't want people to think that this is the final word that women with obesity may not get hit hard by the virus. We have to make sure this is reproduced in prospective studies. But it is important to remember we need to do as much as possible right now to control obesity as well as controlling the pandemic.
Doctor, phase 3 of the vaccine trials, they're going to need a lot of people, tens of thousands of people to participate. And over this past weekend, we found out that researchers are apparently having a problem recruiting Black and Latino participants, which could mean a delay in the trial. Do you know why this is happening?
So, Maria, this is so important. Remember this. Blacks, Hispanics make up more than 50% of the COVID epidemic in the United States. Moderna just announced that they've recruited over 8,000 subjects so far. That's really amazing. They're doing incredible work, but less than 10% are Hispanics and less than 5% are Black. We need to have representation of these groups since we know that these populations are hit really hard by the virus. So the problem is because of the past and history with some of the racial injustices with experiments like Tuskegee, when they tried to look at the natural history of syphilis, there is definitely some mistrust, also some healthcare disparities. Some of these populations are essential workers. They may not be able to take time off to go into these trials because of the Financial Times making it even harder. This is a difficult issue for the different vaccine developers, but it needs to be solved.
Dr. Todd Ellerin from South Shore Health. As always, we appreciate your time. Thank you, Doctor. Be well.
Thanks, guys.
Yeah, great to see you.